everyone, my name is Angelina Phillips, and today I'll be presenting findings from my research on adult attention deficit hyperactivity disorder, also known as ADHD. While often seen as a childhood condition, ADHD frequently continues into adulthood, impacting millions worldwide. Today we'll take a look at its prevalence, diagnostic challenges, treatment strategies, and digital innovations that are transforming care. Now that I've introduced the topic, let's start by looking at the main goal and objectives that guided this project. The goal of this project is to understand how adult ADHD affects daily life and explore both traditional and digital approaches to improve diagnosis, treatment, and access to care. I'll summarize recent research, identify common challenges, and highlight emerging tools and practical implications for healthcare and policy. This project also emphasizes the need to bridge the gap between what research shows and what adults actually experience in real-world care. With those goals in mind, let's take a closer look at what ADHD actually is and how it presents in adults. Adult ADHD involves persistent patterns of inattention, impulsivity, and restlessness that interfere with work, relationships, and daily functioning. Unlike in children, adults often internalize symptoms leading to anxiety, depression, and misdiagnoses. Adults may appear organized or high-functioning externally, but struggle with emotional regulation, time management, and sustaining focus. This often leads to chronic stress or burnout before ADHD is even considered. Understanding these patterns helps explain why ADHD has become such a significant public health concern. Why does this matter? ADHD affects 3.2% to 6.7% of adults globally. It's underdiagnosed in women, minorities, and older adults. Untreated, it contributes to job loss, financial stress, and mental health challenges, increasing healthcare costs and reducing quality of life. For many adults, diagnosis comes only after years of struggling, often when their child is evaluated for ADHD or when symptoms begin to affect relationships or employment. Recognizing adult ADHD early can improve life outcomes dramatically. To better understand these issues, I conducted a structured literature review to capture the most current and credible evidence. The structured literature review I conducted is comprised of 40 peer-reviewed studies from 2020 to 2025 using PubMed, APA PsycInfo, and EBSCOhost. The review included systematic reviews, random controlled trials, and digital health evaluations to identify trends and gaps in adult ADHD research. This was just to name a few. The findings from this review reveal key trends in how common adult ADHD is and how it often overlaps with other health conditions. As I mentioned earlier, 3.2 to 6.7% of adults globally have ADHD. Women are often misdiagnosed due to cellular symptoms. Common co-occurring conditions include anxiety, sleep problems, substance use, and autism spectrum disorder, just to name a few, compounding daily impairment and emotional fatigue. These overlapping conditions make treatment more complex, requiring integrative approaches that address both ADHD and co-occurring mental health needs. These overlapping conditions make diagnosis even more complex, which brings us to some of the main barriers and new trends in assessment. Diagnosis can take 7 to 10 years from symptom onset. Bias, overlapping conditions, and limited adult tools can cause delays. However, telehealth and AI-supported assessments are improving access while raising important questions around accuracy and ethics. Many diagnostic tools were originally designed for children, which means adults often fall through the cracks. The lack of provider training and stigma further discourage people from seeking evaluation. Once adults receive an accurate diagnosis, treatment becomes the next critical step in improving daily life and long-term outcomes. Effective care combines medication, therapy, and lifestyle changes. Cognitive behavioral therapy helps with organization and emotional control. Exercise, structure, and coaching support long-term success. Digital tools and workplace programs also enhance daily functioning. Evidence also supports psychoeducation, which is helping adults understand their symptoms and strengths as a key component of sustained progress. Multimodal approaches are most successful when they include both behavioral and environmental supports. Building on traditional treatment methods, technology is now reshaping how ADHD is managed, diagnosed, and supported. As I mentioned, technology is changing how ADHD is assessed and managed. AI apps track focus and behavior, while wearables offer real-time data on attention and restlessness. Telehealth expands access, especially for adults facing barriers to in-person care. However, it's vital to address ethics, ensuring algorithms are accurate across diverse populations, data privacy is protected, and clinical oversight prevents misuse or over-reliance on technology. When designed responsibly, these tools can personalize interventions, provide instant feedback, and reduce delays in diagnosis, especially in underserved or rural populations. While these tools expand access, they also highlight broader public health implications and system-level challenges that deserve attention. Adult ADHD carries major health, social, and economic impacts. Underdiagnosis contributes to disparities in care and outcomes. Integrating screening into primary and occupational health can improve early detection and reduce system-level cost. Expanding mental health literacy and promoting ADHD awareness campaigns can help reduce stigma and encourage adults to seek care earlier. Beyond systems and policies, it's also important to recognize the vital role that loved ones and social support play in managing ADHD. Family and peer support play a key role in emotional regulation and daily coping. Encouragement and structure help adults manage symptoms more effectively and sustain treatment success. These personal and social challenges also carry significant economic costs, both for individuals and for society as a whole. Adults with ADHD have 2 to 3 times higher job turnover and absenteeism. Annual productivity losses reach up to $10,000 per person. Early diagnosis and consistent treatment reduce these long-term costs and improve quality of life. For employers and policymakers, supporting ADHD accommodations is not just equitable, it's cost-effective. Retaining skilled workers improves both morale and productivity. Understanding the financial impact helps inform where systems of care can be improved to reduce burden and enhance outcomes. Strengthening cross-sector collaboration, integrating mental health and ADHD care, and using data to tailor interventions are critical for closing gaps and improving outcomes across populations. As we look to the future, there are several promising research directions and opportunities to make adult ADHD care more equitable and effective. Future research should examine aging, gender, and cultural differences in diagnosis, as well as long-term outcomes of digital and AI tools. Broader education and community programs will help promote equity, awareness, and access. Collaboration among researchers, clinicians, and those with lived experience will be essential to designing more inclusive and practical solutions that reflect real-world challenges. In summary, addressing adult ADHD requires collaborative, innovative approach that connects research to technology and compassion. Here are a list of the references I used for this presentation. Adult ADHD is a lifelong condition with wide-reaching effects on health and society. Through innovation, collaboration, and compassion, we can build systems that truly support adults living with ADHD. Thank you so much for listening, and I hope you have a great day.